So inshallah, through today's presentation, we'll take a look at that understanding of what it is, that pursuit of inner peace is, that itmi'nan, that serenity, through some of the concepts that are related to mental health. So we'll have a better understanding of what is mental health. We'll take a look at some statistics. We'll look at some misconceptions, barriers, and common illnesses. We'll also take a look at what is counseling, because I know within our communities this is something that we fear perhaps, or don't have a good understanding, and shy away and move away from that. We'll take a look at some gender variances, which is always interesting to explore. And we'll take a quick look at the signs of depression and anxiety, but we'll get more in depth with that for part 2 later on. Also for supports and resources, we'll get more in depth. If we have time before our first break, perhaps we can do a meditation, or we'll decide together. If not, then we'll leave it at the very end today. So part of this first part is going to be taking a look at these concepts through my own experiential experience as a registered psychotherapist, but also through the clinical work that I do as a counselor. So we'll be sharing stories, of course, confidentially, right? I'm not going to be using names, but scenarios that we're familiar with, and how people struggle with their mental health in order to have a better understanding of what mental illnesses are. So before we begin, I'm not going to be doing all the talking, because that's not going to be fun. I don't want to hear myself talking the whole time. We're going to be very interactive, inshallah. The only way to do this, though, is with your respected participation. So when we hear the word mental health or well-being, what is the first thing that comes to your mind? Please, somebody shout it out. When you hear mental health, and I'm going to try and switch between Arabic and English, but I'm not going to be doing فصحى عربي. رح أحكي هيك مثلكم. We'll have a conversation. من تسمعون الكلمة الصحة النفسية، الصحة العقلية، شنو أول شيء يجي ببالكم؟ نعم؟ توازن, balance?
Peace of mind.
Peace of mind. Hajia, you said something? Junoon, crazy, okay. Usually that's the first thing. I'm surprised to hear this. This is great. Perhaps a few years ago, if I asked this question, that would have been the first response, right? So when you hear well-being, this is what comes to your mind. But when you hear mental health, that's what comes to your mind? يسمعون كلمة الصحة العقلية النفسية رأسا واحد يجيب يعني فكرة الجنون, right? No? Yes? Okay. But you notice what I said. Mental health, well-being. I didn't say mental illness. There's a difference. When we say physical illness or physical health, what comes to your mind? يعني من تسمع الصحة الجسدية شنو أول شيء يجي بالكم؟ جسم, okay, physical. But what about that? What do you? العقل السليم الجسم السليم, absolutely. Peace of mind, peace of body, or peace of body, peace of mind. But when you hear physical illnesses, what comes to your mind? Physical health. Exercise, eating healthy, right? Diabetes. No, physical. Physical. When you hear physical, what comes to your mind? Sports? Okay. What else? Healthy eating? Perhaps some illnesses, cardiovascular diseases, etc., etc. Usually when we put the question out there for physical illnesses, people talk about positive things, exercise, healthy eating, etc., etc. But as soon as we say mental health, we hear the word crazy. Does that make sense? So we want to differentiate here between mental health and mental illnesses, because when we take a look at the definition of what mental health is and well-being, it's about that overall healthy balance, like we said, tawazun, right? In all aspects of your life. So the physical, the social, the spiritual, the economical, and of course the mental. If we take a look at another definition by the World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So it's a balance of everything in which you can contribute. التوازن بكل احتياطات الحياة عشان واحد يقدر يقدم خدمة إلى المجتمع. So it's about that ability. When we take it a step further, we'll take a look at understanding a conscious, self-directed, and evolving process of achieving full potential, right? Reaching that full potential that we all have within us. Why is this important to us? Why do we say that? Because it gives us the opportunity to live a higher quality of life. Everything we do and every emotion that we feel, it is connected to that well-being of ours. It affects our actions and our emotions. So a lot of what we've said here already. And it helps reduce the stress, reduce the risk of illness, and ensure positive interactions, whether it's the individual level, our family, and of course within the community where we work, etc., etc. What's interesting here is when I first started studying psychology, أول ما بديت دراسة بالعلم النفس، أول شيء الناس قالوا لي بالذات من المجتمع العراقي، ليش قاعد تدرسين علم النفس؟ راح تصيرين مخبلة مثل هذول راح تعالجيهم. When I first started studying psychology, that's the first response I got from my community. The Iraqis specifically was, why are you studying psychology? You're going to be just as crazy as those who you'll be treating. And that's one of the misconceptions that we have. Sounds funny, humorous, but the statistics show otherwise, that it's not humorous, that 1 in 4 or 1 in 5 people will experience or have, or you know somebody who will experience a mental health issue over their lifetime. So if you look around in the room, we have around 30, 35 people. 1 in 4 or 5 of us here either ourselves or know somebody or have experienced this. So it's not a joking matter. And especially in the last few years, leading up to the pandemic that we've had, there's been an increase in mental health issues. But also during the pandemic, we see that skyrocketed. That's one of the #1 health issues that we've had, the mental health aspect. So understanding mental health, we need to understand what wellness is all about. If we look here from the University of California, the Davis campus, they came up with this 8 dimensions of wellness. So occupational, emotional, spiritual, environmental, financial, physical, social, and intellectual. And when you take a look at the link, for example, between our faith and mental health and balance and wellness, look at what Imam Musa al-Kadhim alayhi salam says. Divide your time into 4 parts. An hour to Allah subhanahu wa ta'ala, an hour to work, to provide for your family, an hour to socialize with friends, those who are trustworthy and can keep your secrets, of course, not toxic people. And lastly, an hour for yourselves in where you can perform what you desire without falling into haram. What's beautiful about this, it encompasses all of what modern psychology is trying to tell us. And we've had this in our faith for 1400 years, right from the beginning. What does the Prophet say that he was very famous for? And I personally myself call him a genius of psychology when he talks about positivity. And I'll say it in Arabic first. Tafa'alu bil khair tajidu, right? So put out the positivity out there and you will find it. And this is what we call in modern psychology today, positive psychology. There's a whole fara, there's a whole section on positive psychology. And you see that this existed for us for 1400 years ago. Inshallah, in the future we can do a whole presentation, which I do on this topic, which is what I did my graduate studies in. The connection between Islamic counseling and psychology theories and modern psychology to develop practices in either a university setting, which is where I work at Carleton University, in the medical clinic there, also in a community setting. So inshallah we can do that another time, but I will refer back to certain things. Today we're going to just focus on the first part, what is mental health and all the nuances around it. So when we take a look at statistics, like we said earlier, 1 in 5 could be impacted, right? Or personally experience a mental health problem or illness, whether you know somebody or not. That's a pretty big number if you think about it, right? It includes all ages, education, socioeconomic background, and cultures. It is indiscriminatory. It doesn't mean because you come from this culture, or this background, or this financial status, etc., that you will be immune to it. In fact, if we look over the last few years, we've seen some pretty wealthy, famous people, unfortunately, succumb to illnesses and challenges such as suicide as a result of depression. And these people had everything, so to speak, in their lives, yet they were still impacted. We see young people as well, right? We look here at the statistics, 8% of adults will experience this major depression. 10 to 20% of Canadian youth are affected by a mental illness or disorder. 5% of the male youth and 12% of female youth, 12 to 19, have experienced a major depressive episode. And this is relevant to our student population at the school that we're dealing with today. Suicide, unfortunately, is amongst the leading cause of death each year in Canada. And look at this age group, 15 to 24. And this is only second to accidents, car accidents and whatnot. 4,000 people die prematurely each year by suicide. What's interesting is that men are 4 times more likely than women to do this. Why do you suppose that is? It's interesting. Why do you suppose that men are more likely, or the statistics show that? Why do you suppose that is? They don't speak. We'll get into that a little bit more later on in terms of gender variances. That could be part of it. They don't cry. They do, but they don't show it because we're in a society and a community where it doesn't encourage showing emotions. We'll get more into that a little bit later. Perhaps there's more responsibilities, yes. The reason what we look at, including what you've mentioned here, is because they are more likely to do the suicidal act by more violent means, which then does a completed, or what we call a successful, suicide attempt. I know this is heavy, and we're going to be talking more about this, especially later on, but it is a reality we need to explore within our communities. With women, what we see, why we have less numbers in suicide, is because they don't attempt the same way, violent or more aggressive means of ending their lives. I know this is in our community something very icky or a little awkward or strange, or it just makes you feel odd. Inshallah, by the end of today's presentation, what we want to feel is comfortable with these topics. This is how we instigate conversation. This is the whole point of why we do these types of trainings in the general population, but also within our own communities, because we don't talk about these things. And it's important, it's vital that we do. We become familiar, we become comfortable, so that we become a family to help and support each other when people are in need. Just like somebody breaks an arm or a leg, right? We're right away going to the hospital or providing food or helping them. But when we hear somebody who's had a break in their psychosis, in their mind, we run away from that. We don't know how to deal with it. Inshallah, by the end of today, I'm going to say we're going to be somewhat of experts in terms of feeling comfortable with this, and that you become ambassadors for the rest of the community, not just as teachers, but in the community overall, because this is vital. When these statistics are rising, this is, by the way, pre-pandemic statistics. Can you imagine what they are now? Probably more intensified, right? And if we look, I'm just going to quickly go over this here. We look at the impact of how this is on the industry, productivity of people in the workplace, right? And initiatives to take care of our mental health. It's taxing. If we don't take care of it properly, it can really impact at that level. So now let's get into misconceptions. We've already introduced a few of them, but let's go a little bit deeper in terms of what are the misconceptions that we have in our community. What are some of the main barriers? And by the way, all of you have the slides with you right now. So for those of you who are audiovisual learners like me, I always like to write notes. You have a pen and paper to do that as well. So you can follow along as well there. If you are a good listener type of learner, then we have it all here as well. So please feel free to go along and write notes, and you can ask questions, inshallah, as we go along. And finally, we'll take a look at what are the most common mental health illnesses or challenges in our community. So it might be a little bit hard here to read, so you do have them with you, and I'm going to go in depth with them, and this is where we're going to work together, okay? So number one, when we take a look at what are the misconceptions, we hear the myth of, or is it fact, that mental illnesses are not real. What are your thoughts on that? Yes, no, come on. We need participation. Are they real or not real? They are, right? Just because you cannot see it doesn't make it not real. Like we said, if somebody has a broken arm or leg, we can see that, right? But somebody who doesn't have a broken arm or leg, even somebody, let's say, who has diabetes, right? I think in our community we kind of boast, we show off. من واحد يكون مريض بمجتمعاتنا يقول إيه أنا عندي قلب وأنا عندي سكر وأنا هلقد أدوية وهلقد appointments and this and that. We kind of brag and show off how much we have, right? But when it comes to mental illnesses, absolute silence. عيب شنو هالحكي شنو هاي مخبلة صايرة ذاك صار هيك بيتهم هذا الحكي كله دائما نسمعه. The reality is, if we don't put focus on that and learn, just like we say here, that it is real, because a lot of the parents in our communities, and I know this working at the university level and with youth, and I hear this from this age group, and especially from Muslim, cultural, diverse Arab communities, that my parents don't believe in mental health. I have African students, I have Asian students, I have Southeast Asian students, I have Arab students that say the same thing. So I'll say a joke like, oh, you mean like a typical African family? Like, yeah, like that. You just believe in God and that's it. Right? Same thing in our Arabic communities. صح؟ إذا واحد عنده إيمان خلاص that's it. لا جنون، لا صحة نفسية تعبانة، لا ولا شيء. روح اقرأ القرآن والدعاء وهاي هي. Now there is a truth to that. I'll get into it a little bit later. Absolutely. There's a huge link between faith and psychology and mental health. But let me ask you this question. إذا واحد كسر رجله لو إيديه راح تقولوا له روح اقرأ القرآن. Somebody breaks their arms or leg, are you going to go tell them, go read the Quran? Is that going to help them with their physical pain, with a broken bone? راح يساعد القرآن بهالحالة إذا واحد كسر رجله لو إيديه بالألم؟ أنتوا قولوا لي. Yes or no? What is it that you do? You go straight to the hospital, you go to the emergency, get that bone fixed, put in a cast. Morphine? Drugs? Yes, to subside the pain? Absolutely. Once you stabilize a person, then you get into the spiritual, then you get into, all right, let's do some du'as to help ease, right? To find that serenity. We'll get into that after. So just because you cannot see it, it doesn't mean that it's not real. It is real. It is real. When the statistics show that, when people are taking their lives, young, old, are resorting to that, it is real. Number two, mental illnesses will never affect me. What are your thoughts on that? I think we're all the same. الأمراض النفسية ما راح تأثر علي. مو صح هذا الحكي. What did we say earlier? It is indiscriminate of any background. How rich you are, how much faith you have, what cultural background you are, how educated or uneducated. It's indiscriminate. Number three, mental illnesses are just an excuse for poor behavior. What do you think? Now it is true that people who experience mental illnesses, they may act in ways that are unexpected or can seem strange. يعني الواحد عنده حالة نفسية ممكن يسوي يعني حركات شغلات غريبة صحيح. But we need to remember that it's the illness. إن هذا هو المرض مو الشخص, not the person behind these behaviors. So no one chooses, like you don't go choose to break an arm or a leg. You don't choose to go have diabetes, well, unless you don't properly take care of your food intake and just eating sugary foods all the time, etc., etc. But it also can be a genetic factor, right? So it's important to understand that people who experience a change in their behavior due to the mental illness, they may feel very embarrassed themselves, right? Or ashamed around other people. It's true that people with a history of mental illnesses are like anyone else. they can make poor choices or do something unexpected for reasons unrelated to symptoms of their illness. So we need to have a bit of compassion and understanding towards folks who are experiencing that. Number 4 is one of my favorites. Bad parenting causes mental illness. What do you think of that? I see a lot of yeses. Bad parenting? You say it's very true? The response to that is that there is no one factor that can contribute or cause mental illness, right? They are complicated conditions that arise from a combination of what? We already mentioned something. Genetics, right? Biology, environment, nurture, nature, right? And life experiences. Family members, however, and loved ones, they have a big role to play in terms of the support and the recovery. Does that make sense? So it's not the cause. You could say that it's part of the environment and the upbringing, bad parenting, but it's not the full cause. Number 5, people with mental illnesses are violent and dangerous. That's what the media seems to tell us. عدوان هواي اللي عنده حالة نفسية يكون يعني عدوان عنده. Is that the right word in Arabic? Violent? What's violent in Arabic? عنف, that's right. يكون عنيف. What do you think of that? I'm really impressed by the Iraqi embassy, really involved in this, mashallah, that's great. I want to hear more from everybody else as well. What do you think? People with mental illnesses are violent and aggressive. Now we do know that some people try to predict violence so they know how to avoid it. However, the causes of violence, that itself is complicated, and researchers agree that mental illnesses are not a good predictor of violence. In fact, if we look at mental illnesses on their own, people who experience them are no more violent than the regular person. So excluding people from the community is a cause of violence. We know that. Exclusion. And people with mental illnesses are often amongst those who are isolated and excluded, right? So it's important to note that people who experience these mental illnesses are much more likely to be victims. يكونون ضحايا to that violence and that aggression. So number 6, yes. So the sister is asking, why is it here? I'm assuming you mean the media. Says when somebody is involved in a violent act, why is it that right away the media says, oh, he has a mental illness? Let me ask you, and I'm going to say it straight up, were they white? So there's deeper layers involved here. We have to be real. We have to get down to the root causes and understanding of media. That's a whole other topic, and you need experts on that. Although I do talk a bit about it because it is psychologically rooted, we need to understand that there's bias and racism in the media, in our communities, whether it's our own, but also outside. Now, if this person was, let's say, black, let's say this person distinctively looks Muslim. Oh, this person had a hijab on. What kind of title would this person have? Would they be titled as somebody with a mental health illness, or terrorist, or violent this, or Islamic fundamentalist, etc.? We know this. This is how the media portrays, because they have an agenda. They're not really acknowledging. Now, what if it was somebody who happened to be of a distinct racial background or a cultural or religious background who also happened to have mental health issues? That's an interesting one to play around with. Haven't seen that one yet, right? But it's important to understand that there are deeper issues at play here in the media and politics, etc., that have an impact on how people portray things in the media. Thank you for sharing that. I think that was a really important, valid point. So let's move on a little bit here. Number 6, people do not recover from mental illnesses. What do you think about this one? They do? They establish and they open the hospitals. Ahsantum, exactly. So people can. Now, I bring it back to you in a different way. Can people recover from cardiovascular diseases or diabetes? Can they? Potentially, right? But does it not become a lifelong condition that they have to learn how to manage? So somebody could be diagnosed with anxiety, tawattur, or depression, ka'aba. However, they don't necessarily get rid of it. They still have it. They live with it, right? However, they can manage it with what? With therapy, medication, proper lifestyle changes. الاهتمام بالصحة النفسية إذا واحد عنده حالة الكآبة التوتر لو أي حالة مثل السكر والحالات الأمراض القلبية إذا يعالجها بالدواء والعلاج مع الأطباء يهتم بأكله بالصحة الرياضة بالضغوطات بالحياة, that will have a positive impact on their life. You can still live with it, but you manage it. There are some days it's going to be worse than others. Again, I correlate it and compare it to physical illnesses because they're very similar that way. If we can learn to look, again, at mental health and mental illnesses similar to physical illnesses, then we get rid of those misconceptions. We become more comfortable. Then we can openly talk about it. بعدين الحكي والحجيات وقت الشاي والقهوة وهالسوالف والقعدات then نقدر نحكي بهالمواضيع بسهولة مو بخوف وبرعب وبعيب وواحد يخاف. So we can have these normal conversations in any gathering that we have, our social gatherings. I know it's difficult now with the pandemic, but this is the time I believe that we need to talk about this even more, to reach out to people who are isolated because we miss our social interactions, wouldn't you say? Number 7. People, oh by the way, and yes, some people can recover. I forgot to mention that. Although some will live with it with their whole life and learn how to manage it, there are others who can absolutely recover. It could be just a time in their lives, and I can attest to that from the students that I see. There are people who come and have psychotic breakdowns, suicide attempts, anxiety attacks, deep depressive states. And I've seen recovery. Why? They come and get help, they come and get support. Perhaps some take medication. And I know that's something within our community, we're like, oh no, I don't want to get addicted to medication. Hey, but aren't you taking insulin? You need that to survive. You need that to balance your glucose levels. Same thing when it comes to these types of challenges. With intensive therapy, with lifestyle changes, with getting rid of toxic people and energies around you, educating yourself, proper diets, right? Exercise, workouts, all of these things, they have a huge positive impact in the recovery process. It could be that you were triggered by past trauma. It could be a breakup of a marriage or a relationship. It could be abuse, right? It could be a drug problem, etc., etc., etc. Mostly in the university setting around this time of year, what is it? Stress, right? And you probably have that with your students who have midterms and exams and assignments. It's stress. And I'm jumping ahead, but we'll get to it in a moment. So people, number 7, who experience mental illness are weak and cannot handle stress. What are your thoughts on that? Put in your mind physical, mental illnesses. When you compare the two, people who have physical illnesses, can they participate and deal with stress and deal with work, deal with life?
I think it's fine.
It's fine, right? But again, our misconceptions والأفكار اللي عندنا عن الصحة النفسية تخلينا نفكر إن الشخص إذا عدى هالحالات النفسية ما يقدر يشتغل, he can't contribute, or can't handle stress. And that's not true. What's interesting is that people who deal with these types of illnesses and challenges actually become better at managing stress because they learn ahead of time what triggers them, what causes them to feel stressed. Each one of us, and that's another presentation that I do where I talk specifically on stress management, and inshallah we'll do it another day. But the idea here is that each of us has our own stress print, just like we have our own individual fingerprint, wouldn't you say? So you perhaps deal with stress different than the madam, right? You perhaps, we all deal with stress differently. Some people have a high tolerance of stress, but there comes a point in our lives where it overflows, right? Not because you don't believe in God, not because you don't have faith. We're human. And we see that with the examples of the prophets and the imams and the Ahl al-Bayt and all of these examples. I'm not going to get too much deep into it, but for those of us who follow that path and take inspiration from that, I think they exemplified that. We just finished the last 2 months of mourning of the tragedy of Karbala. And this year specifically, I've taken a deeper interest in studying it from a psychological point of view, where when we look at courage, motivation, altruism, all of these concepts, psychological concepts, are a form of inspiration that we can take from that tragedy to apply to our own lives. It doesn't matter what your faith level is. But when you hear stories like that, it inspires you, right? And it doesn't prevent you from learning how to deal with stress. You can definitely deal with stress because you recognize how you respond to stress. So you become proactive in taking care of that stress before it gets out of hand. Just quickly, and if you're comfortable sharing, and I'll begin to start, my stress symptoms have always been, and I learned this when I was young, the hard way, is anxiety. Heart racing, pumping, you get sweaty, anxious, lots of thinking, overthinking, nervousness. I even experienced anxiety attacks before. I had no idea. I remember vividly the first panic attack I had. I was in, at that time we had grade 13 in Ontario. I was in the OAC math, calculus or algebra. أنا عقلي أدبي, أدبي مو علمي. And I was sitting in a calculus algebra class. And for no reason, out of the blue, I got a panic attack. My heart started racing, shaking and sweating, and that breathing that comes with it. And then I fainted. They stopped the class. They called the ambulance. They took me out on a stretcher to the hospital. I had no idea what was going on. I'm sure you've heard and seen people with this. You perhaps have experienced this. And I remember going from doctor to doctor, cardiologist, neurologist, hemoglobin specialist, blood doctor. All of these different doctors with my dad, bless him, with me. And they couldn't figure out what was going on. One doctor in particular, who was Southeast Asian, Dr. Khan, we walked in, we sat down, he took one look at me, few questions, and told my dad, bless him, back off. You're putting too much pressure on her in school. That pressure is causing her to feel this way. What's interesting is what happened when we reflected back to what happened here during this time in my life, is that I went from a regular school schedule to my dad condensing a 5-year program to 4, because he wanted me to apply to science, to a science degree, so that I can complete it and then apply for medical school. So I come from that background, and my dad has a PhD in physics, bless him, and I'm the eldest, Ani Chabira, and he wanted me to go in that direction. So I was groomed towards medicine my entire life when I was younger. Well, I wanted it too. The idea we have in our communities. What I didn't understand is that my brain was allergic, you could say. I appreciated the sciences, especially given my dad and the PhD and research and a professor and all these publications. I used to, by the way, because of the English, I used to always read and edit the English of those research papers. But what happened was, when I switched from the 5-year program, which was meant for us to go slow and learn, to a 4-year program condensed, I remember I used to study in the washrooms during lunch breaks. All the fun courses and spares were gone. Pressure, my stress print here, in the form of anxiety, caused these panic attacks. I was even put on medication for a while. And that's something, again, we fear in our communities. I don't particularly believe that medication helped. What changed for me was balance, like you were saying earlier, balance. I went back to a 5-year program and put breaks, spares. I put a cooking class, I put a gym class, a junior chef class, an art class, balance. Guess what? My grades started going up again. I got a scholarship to get into university. I switched from going into pre-medicine full sciences by taking psychology, which was my main degree, and a few sciences that I needed to get into medical school. We'll talk about that later, what happened. But essentially, I give you the story here to understand how we can respond to different normal stresses that we have in our lives. Now I remember early on from that first initial experience, that type of stress happened again and again and again. If I don't eat well, if I don't sleep well, if I don't exercise, those stress hormones in the body, they make you go like this. That's a sign. That's a notification from your brain to your body. Just like we get notifications here, your brain is sending notifications to you. Hey, if you don't listen to me, if you don't pay attention to these signs and signals, so you have to listen, otherwise you're going to crash. Inshallah, in the future we can talk more about that. But the emphasis here is that you need to understand how your body responds to stress so you can reverse the effect of it, because it's going to come up again and again in your life. It still happens to me now. But because I've learned now how to manage it, I don't get those panic attacks anymore. Number 8, people who experience mental illnesses cannot work. What are your thoughts on that? Can they work? Sure. Can work with just like people who have physical disabilities or illnesses, with accommodation and understanding. I think there's a different work environment attitude now than we had a few years back. I know this is the case in Ontario. I'm not sure how it's here in Quebec, but it's more understanding and more supportive when there's a need for that type of accommodation. Definitely now in the pandemic, most of us are working from home, right? So that eases the stress of having to go in the workplace. So number 9, kids can have a mental illness like depression. These are adult problems only. What are your thoughts on that? Not true. Absolutely, especially the population that we're working with today, right? Inshallah, later in the training we'll get into details. But the idea here is that even children, they absolutely can experience this. The problem is that many of these signs and these illnesses happen early. They happen early in life, but we don't pay attention to them. How many of us in our communities can say that perhaps some child that's acting out, some child that is behaving in a bad way, anger, say, هذا مخبل, you know, this kid's just crazy, he's just misbehaving, he's got issues, you know, he comes from a bad home. Do we not say these excuses? Rather than perhaps looking at it from a different way, which is, perhaps this child is dealing with some issues. Sorry, can I just make a suggestion, which I forgot to say at the beginning? Any of us who have phones, just put it on silent so that it doesn't disrupt the attention flow. I don't mind for me, but just the attention of everybody. So it's really important that we capture this young with the children. I can tell you, working with post-secondary students, that a lot of these students, they slip through the cracks. By the time they come to university, they're dealing with depression, they're not doing well in school. Why? Why is that? A lot of them have ADHD, attention deficit hyperactivity disorder, right? What happens is early on, this wasn't caught by the teachers or the parents. These students don't do well, which then becomes a vicious cycle. They don't do well, they feel sad, they feel depressed, they feel anxious, and then it just continues and continues. So alhamdulillah, in our clinic at Carlson, we do have a specialist, a general practitioner who can assess ADHD and treat it with its medication, but we also have a center called the Paul Menton Center, which is for students with disabilities, physical as well as mental. And they have accommodation and support and a learning strategist. So these students that come to me, and I'll share a quick story. I had a client a few years ago, a Muslim convert actually, lovely, lovely gentleman. He was in university at this point 6 years. He was failing. He came to me feeling depressed. He was very upset that he wasn't doing well. And he wanted to graduate and make something of himself. And I remember he came from a Caribbean culture, similar to African, and I would say similar to Middle Eastern in our cultures when it came to the attitudes around mental health. Ironically, he had a parent that was a nurse in the medical field, but did not believe in mental health. And so when he was struggling, he didn't get the support that he wanted or needed. He comes and talks about depression, etc., etc. You know, tried to help him do this, do that. Okay, let's try this, let's try that. But he was always missing appointments. He was always late. It wasn't a personal thing. It was related to what he had. It occurred to me one day, this was early on in my practice, perhaps this young man is struggling with more than depression. Let's get a medical assessment. When he did, it was exactly what I suspected, ADHD. I was so happy to hear this because then we knew next steps what to do. connected him to the doctor, get the medication, also connected him to the Paul Menton Center because they can provide accommodations and academic support. Now this young man, because of the culture that he came from, he got the prescription, he never went and got the medication. Why? Get the medication, get started. No, my mom thinks it's this, and that, even though she's a medical profession. Culture and misconceptions overrode what he needed to take. Alhamdulillah, finally convinced him to take it. I'm not kidding you when I say night and day difference. I saw him within a 2-week period of taking this medication. I didn't recognize him when he came to see me. By the way, he gave me permission to use his story. I've been using it for years because of how inspiring. Look what this young man did. Not only did he start getting A's on his exams and assignments because the medication helps you focus. He used it as directed. He was also able to recognize this within his own circle of friends. He started telling them, go see Barak. Go to the clinic, get assessed, get support. Why are you suffering and struggling? His depression, gone. Within 2 weeks, gone. It wasn't depression, it was the result. The sadness was a result of this issue. There's always concurrent and underlying issues. Alhamdulillah. He succeeded in his studies, he graduated. He always sends me an email at least once a year, Eid Mubarak and all that, and telling me updates of how he's doing, and also thanking me and the doctor that helped him get the support, putting his cultural and nuances and misconceptions and taboos aside to get the help that he needed so that he can succeed. This is important as teachers and educators, as parents, that we recognize early on. Inshallah, next presentation we'll get into depth. But I always love sharing this young man's story of success because he went, despite the challenges, got the support, succeeded, graduated, and worked. And is happy now, alhamdulillah. So quickly, number 10, finally, everyone gets depressed as they grow older. It's just a part of the aging process. What do you think? What do you think of this one? Is it just part of the aging process that we get depressed as we get older? No. I've seen some of the happiest elderly people around.
They bloom after.
They bloom, some of them bloom after, right? So why do you suppose we have that idea? Now we know that it is never I always say this wrong, inevitable, there we go, part of aging. Now we know also that when somebody gets older, they're more at risk of depression because they experience so many changes in their role and social networks. That's the link there. Not because they're aging, but because of the change. Have any of you noticed your elderly parents, if they're still around, and those who are gone, Allah yarhamhum, have you noticed that change perhaps? What I find interesting from my observations within our community, that is not the case so much within our communities. Why do you suppose that is? I see this more in others. In our community, we're very family oriented, right? We come from a culture that usually when the young man marries, he brings the wife into the house, he stays with his family or the daughter. We're very close to our parents. We don't just dump them in a senior home because they're seniors. Sometimes I know perhaps I shouldn't use the word dump, but we know there's that attitude as soon as you turn a certain age. Even as teenagers, you're 16, 17, you're legal, get out. It's very different from perhaps our cultural norms, right? There are circumstances sometimes that elderly seniors need to go into a home because perhaps we cannot care for them the same way. There's those reasons, of course, as well. But overall, we find that our parents are very close. We're close to each other that way. And I find that reduces that. This perhaps back home in our countries, but I find here it's a little bit more challenging. And I hear a lot of elderly folks say, قاعدين بين أربع حيطان, we're sitting amongst four walls. It's a different culture here. And going back and forth to Iraq and here, I noticed that the elderlies in our homes, they have a status, right? They have a role. They're like the sheikh and the sheikha of each household, right? It's a different culture that I find than the elder community here. So again, the reality is because the role changes. And I remember my grandmother, Allah yarhamha, although she was still, let's say, the head, and she was one of the last elderly ones left in our family, I still remember my khala, my aunt, giving her something important to make her feel useful. right? And she would give her the greens to clean and separate. الخضروات تعطيها لبيبيتي حتى تنظفن, because that was important for her to do. Or teaching the younger kids, or playing an important role with the grandchildren. So giving that importance and that role to the elderly has a huge impact on their mental health. There's a whole field of that for the elderly. So any other ideas? I always like to add this last one here. The Muslim myths that we have when it comes to jinn possession, lack of faith that leads to poor mental health, etc., etc. These are pretty common, wouldn't you say? When you see somebody behaving a little bit differently than usual, هذا محسود هذا راكب للجن.
Sometimes some people, they have like autism, but they didn't know what it is, so they put them in like in a room, make us a holy person, and start preaching. So this is one of the villages in Iraq.
Exactly, maktub kitab alayha, you know, those types of things. Now, I'm not saying that's not true. This is in our faith. We know it exists. There are specific ayahs and surahs in the Quran that talk about these things. The hadith, the history, it's there. And I work very closely with the sheikhs, the alimas, the scholars in the Muslim community. We've had these discussions. And it comes down to, sure, they tend to be the frontline workers, so to speak, in our community. The go-to. People go to them right away as people of knowledge. Absolutely. They themselves will tell you, the ones who have the proper understanding and no ego, will say, I can't treat you for this. Take them to the hospital. Take them to the doctor. Because there are spiritual treatments. Absolutely. There is spiritual treatments that can help. But if that doesn't work, right? Sure, the person can feel calmer, a little bit more relaxed when you hear surah from the Quran, and they talk about ruqya shari and all that kind of stuff. Absolutely. But if that doesn't treat it, it just makes you feel a bit better, you need to go to the medical professionals and the mental health professionals. Makes sense, right? And I think this is something we need to explore a little bit more. All right, let's move on a little bit. What time is it? Okay, we're doing well. But before we do this, how about we just stand up? Let's all stand up and take a little 2-minute body stretch. Just tense and relax your muscles. Tense and relax your muscles. No, we're not leaving. We're just standing where we are. Just tense. Yeah, tense and stretch. Tense and stretch. Maybe lift up your arms. Touch your toes if you want. Sideways. Yeah, just get the blood circulating. All right, get the blood up here. Do some deep breathing. We don't want to get sleepy yet. We'll do this activity later. But just get the blood flowing so it feel a little bit more. All right. Can we perhaps have one of the doors open to get some fresh air in here? It was open, or they closed it? Perhaps this one here to get some fresh air?
It's so interesting. Wallahi, I'm impressed. Hope like we can see you again.
Inshallah.
We have another commitment. So.
Absolutely. Thank you so much for coming. I'm honored that you came here.
Thank you so much. Do you have your business card?
I'm دكتورة بس شكرا.
Do you have your business card?
I do.
Please.
على تواصل أنا لسه البارحة واصل.
من العراق؟
أنا القنصل العام.
نعم.
أي شيء تحتاجه إن شاء الله في خدمة.
الله يسلمكم أشكركم. مأجورين شكرا جزيلا الله يحفظكم.
وعدي لسه وعدني البارحة فمباشر.
أنا ما كسب رقم تليفوني عليه. So I'll just jot down my number as well.
إن شاء الله. We will touch إن شاء الله.
Like very, you are a influencer, honestly. طريقة الحديث, I'm so interested.
الله يحفظكم أشكركم. أهلا وسهلا بكم شرفتونا أهلا. الله يسلمكم يا هلا. Are we stretched out well now? We're good? Got the blood flowing? All right, let's continue the next part, inshallah. Just wait a moment. For time. Feeling a little bit more refreshed? Got some water? By the way, there's some amazing food and snacks to nourish our brains and our bodies, healthy stuff that Sister May set out for us. So inshallah, during our break, we'll do that. Absolutely. All right, so we've gone in depth with a lot of ideas in terms of the misconceptions and the taboos. Let's take a look at some of the barriers. What do you think are some of the main barriers in our community when it comes to mental health? What are the barriers? And what I mean by barriers in terms of people getting support, going to the right places. What do you say about language? اللغة. That can be preventative. And what I mean by language, I mean the actual language in itself, as in Arabic English, or the context of the language. Meaning, if I say, you are depressed, you're like, no, I'm not, I'm fine. That word, depression, you automatically think it's a clinical term. There's a big X on you, there's something wrong with you. What if we were to approach the language in a softer way, such as, it seems to me that you are very tired, you're very fatigued, right? You're not engaged as you once were before, in whether it's school or activities, in the community, in your family, your hygiene, right? You're not washing, you're not taking care of your hygiene, your clothes, right? You're overeating, you're undereating, you're oversleeping, undersleeping, etc., etc. When you see and hear that, what does that indicate to you? So when you approach somebody softly with that, they're probably more likely to accept that than you telling them, I think you're depressed. Wouldn't you say? So when you use that type of thing in terms of the language, then it becomes more approachable for people to accept it perhaps. As well, of course, the actual language. Right? إذا ما عندكم واحد يعالجكم مثلا باللغة العربية or from the same culture, يجوز واحد ما راح يروح يحصل هالعلاج, right? Perhaps it's harder, يكون أصعب يعني. By the way, are we okay with the English Arabic so far? الكل قاعد يفهم يعني بين الاثنين عادي لو أكثر تردون. It's good? Okay. I usually present this in English, so I'm going with the Arabic as we go along. Access, that's another one. Where can we go? Who do we go to? Right? Where can we get mental health supports? Now it's almost a standard. Any medical clinic, you have practitioners in there who have mental health training, have mental health specialty, or at least an understanding. So it's not as it was before. I just want to quickly go over some important professions in the field so we understand, because sometimes we just get them all thrown together. Like the gentleman just called me doctora, and right away when you study psychology in the Iraqi culture, صار دكتور لو دكتورة, right? Right away you become a doctor. And I see that all the time. My Arabic clients always call me doctora. I'm like, wallah, أنا مو دكتورة, you know? And so let's understand what this means. So the actual doctor or doctora, you have psychiatrists, okay? Those of you who'd like to jot this down so you don't forget, this is important to understand. So you know who you're dealing with, because you need to know this for later in the training for who you're going to refer people to. Psychiatrist, who can tell me what that is? بالعربي دكتور علم النفس. But what does that mean? What do they do? What are their qualifications? So, a psychiatrist is a medical doctor, medical doctor with specialty in psychiatric illnesses, severe mental health illnesses, such as schizophrenia, such as major depressive disorders, these types of illnesses, okay? Psychiatrists can diagnose, prescribe medication, as well as do treatment. They are specialists, just like you have cardiologists who are medical doctors, right? Neurologists, etc., etc. The thing is with psychiatrists, they have a reputation and a stereotype. One time I said this in London, England, and one psychiatrist in the audience got up and said, I'm a psychiatrist, I don't do that. I'm like, hey, sorry, it's a misconception. They're pill poppers, meaning they just give you medication, see you 6 months. Some are like that. I've come across them like that. Some do actual treatment. Okay, psychiatrist. Psychologist. What's the difference? Who can tell me what's the difference? They're therapists, but what is their degree? Is it a medical degree? A psychologist? A psychologist is not a medical degree, okay? It's a PhD in psychology. They're still considered doctors. They're called doctors. Maybe that's why I get called doctor, right? But they don't have a medical background. Psychologists can be both experimental and clinical. So these are the ones that do the research. You know those statistics we talk about? Psychologists research that, okay? They also can diagnose. Can they prescribe medications? Can they? No. They cannot prescribe medication, they can diagnose. In a university setting, they're useless. We want people, if you're gonna diagnose, you better be able to prescribe medication as well, all right? These types of professionals, they work, let's say in the government, in research, at a university as professors, right? And research at the university as well, but they also have their own private practice. They also charge a lot more because they're not covered by in Ontario, the OHIP, or the provincial medical system, because they're not medical, right? So these are the people you go to for specials. They're very specialists in terms of anxiety, marriage issues, or et cetera, ADHD, right? But you have to pay out of pocket for them unless you have insurance coverage. They can charge quite a bit. Then you have psychotherapists, or in Ontario, as they're known, registered psychotherapists, like I am, an RP. What does that mean? Who are we? What do we do? So we have graduate degrees, could be master's or PhD, okay? We're not called doctors unless you do a PhD. And we also have to be part of this body. In Ontario, it's called the College of Registered Psychotherapists of Ontario. And each province has something like that because it is a legally protected profession. Meaning, just like doctors, just like lawyers, just like plumbers, there's a liability for the public, protection of the public. Does that make sense? So just like everybody else, we have that. And we also follow a code of ethics, rules, when it comes to confidentiality, because that's a big issue in our community. Confidentiality. الناس يخافون يروحون لطبيب نفساني لو معالج نفسي لأن يخافون أسرارهم راح تنطش بالمجتمع. That's one of the barriers that we have when it comes to that. And the idea here is, however, that we are legally bound by this confidentiality. Mind you, any profession you have people who don't follow their guidelines are going to break them, whether you're a lawyer or a medical doctor. So this same thing could apply here. It's a personal thing, but legally, we're not allowed. We get a lot of trouble. Quite a bit. But I respect my profession because I'm passionate about it. And I wouldn't be doing this for 13 years if I didn't believe in what I do, especially within our communities. So, psychotherapists, we are the popular ones at the university and other institutions. Why? We don't charge by the hour like psychologists. We do the therapy. Psychologists and psychiatrists, they tend to refer to us to do the therapy, right? So we cannot diagnose. We can assess, meaning we can say this person seems to exhibit symptoms of depression. If I want to confirm that, especially working in a medical clinic, I have the blessing of working with medical professionals that I could just call up right away and set an appointment for my client to get that done. And that is a really good system to have, where you have both the medical as well as the mental health to be able to do that. So we do the therapeutic work. Some of us could be more specialized than others. For example, at my university, I'm known as the International Student Counselor. So I get all the international students, as well as locals. And because I have a Muslim background, yeah, the Muslims are sent over to me. What's funny is that sometimes the Muslim clients themselves don't want a Muslim client or professional. Why? Because of confidentiality, because of fear of judgment. Do you know how many times I go into the waiting room, not now, but back before COVID, where I come in and then you see a student looking at me in absolute fear and horror. Why do you suppose that is? It's almost as though I could see their mind going, oh my God, I have to tell her all the haram that I've done. But we don't even get into that. If they're coming in, if they are addicted to drugs, pornography, I have seen many young men in our communities that have these issues. Like I said, we're going to talk about things that make us feel uncomfortable, but we need to understand this so we know how to deal with it, right? And we have this. So when the student comes to the sessions, and I'm jumping ahead, I'm going to pause because I do get into that. But the idea is to focus on the issue, not who you are, what you are. And people are a bit worried about that. So we'll get to that a little bit later. So we've talking about psychiatrists, psychologists, registered psychotherapists. We also have social workers. People with social work degrees are very similar to registered psychotherapists. They do case management, but also do therapy. The clinic where I work at, we have both social workers as well as that. There are other specialists as well, but if they are not licensed, if they're not under a body, a regulated body, because back in the day before it became a regulated term, كل واحد يلطخ يسمي نفسه therapist. Now what do we have? Life coaches, my favorites. There's no regulated body for life coaches, meaning liability if there's an issue, right? They're not trained the same way. Bless them. They do have a role to play, which is in terms of empowerment, encouraging, perhaps giving a view, helping people that are stuck somewhere, but not when it comes to mental health issues, right? And illnesses. This is where these professionals come in place. Finally, I'm trying to see if we covered, I think we covered, one more. And I always leave this one last. I call them the unicorns because they're very rare and almost non-existent. The general practitioner psychotherapist, GP psychotherapist. From what we've said so far, what do you think the GP psychotherapist is? What do you think a GP psychotherapist is? Can someone share, please? So GP, general practitioner, medical doctor, psychotherapist. They are trained in psychotherapy. They can not only diagnose, give medication, but they do the full treatment as well. They do the therapy, and they can also be specialized. These are the ones that can do the diagnosis and assessment for ADHD. We have one in our office now. We used to have two, one retired last year. كل الضغط صار عليه, poor guy. We have like a wait list for students to see the GP psychotherapist. However, in the community, if you were to see a specialist, you have to pay between $2,000 to $3,000 to get this assessment done. So I think a lot of people would rather wait than go unless you have insurance coverage. Okay? All right, access, I think we're good on that now. We have a good understanding of who the professionals are, right? Now, part of what I do in my work, what I do, is not part of my university work, although they're very familiar with what I do. For me, this is a passion, the mental health advocacy, because of what I've seen in our communities. A few years ago, we had 2 young Lebanese men take their lives in the Ottawa community. This is around 7 years ago. And I remember a group of us came down here to Montreal to attend an event that Sister Fatima Ali had with Hajj Hassanin Rajab Ali. And we came around 60 youths with some adults. And we were inspired. We were inspired by how the sister put on this whole event on addictions, I recall, addictions and recovery and just the misconceptions around that. And she had some really powerful speakers, including Hajj Hassanin. We had Dr. Tim Sharp, is that correct, the name? And the former football player Alvin Powell, correct? I get the names right? Sorry? Dr. Sharp. Short? Short, not sharp, okay. They were incredibly powerful speakers. And I remember the youth were quite inspired. That night on the bus back to where we were staying, because we stayed for the whole weekend, we talked about, we need to do something like this in Ottawa. We need to bring more awareness to these types of issues. And me being a mental health professional said, hey, let's do it on mental health. Let's have a conference on mental health. And they were like, oh wow. SubhanAllah, that night we stayed up till Fajr, 4 a.m. I remember. A whole group of these people sat up and were brainstorming, thinking, what can we do in our community to bring more awareness? Because just around that time, like I said, we had 2 young men who took their lives. And a lot of these people were connected to those families. They were really deeply impacted. They didn't know how to talk about it. SubhanAllah, from this idea, which was inspired from this conference, we developed a group called the Serenity Islamic Mental Health Awareness Group. And this group wasn't just a one-time conference. After I asked advice from Sister Fatima and Sister Anisa Khan in Toronto and other mentors that I look up to, they said, don't make it a one-time thing. Make it a consistent thing of psychoeducational events so that people can benefit from and learn from it. You can't just have a one-time thing and that's it, everybody goes home. Alhamdulillah, this year, despite the pandemic, we commemorated our 5-year anniversary of these types of events where we had psychoeducational events when we're talking about access and language and resources and culture and all of these things that we struggle with to address these issues. And they're all volunteers, youths, people who are studying it, professionals like me, very tiny group, but had a huge impact in terms of working with other Muslim youth groups, masjids, Hussainiyas, and even across the province. We did events in Toronto as well with other youth groups to bring more awareness around mental health. This year we had planned our 5th-year conference. We had booked Sheikh Azhar Nasser to come because he's a very big supporter of our work. We had other professionals, we had a banquet hall set up, we had flights booked, everything was set. We even had some amazing, swag from Iraq that I had brought in to give to people, and all these plans. Allah's the best of planners. We had to cancel. We did it online. Full circle, sister. We had Hajj Hassanin Rajab Ali with us, Hajj Sheikh Azhar Nasser, and we had Sister Anisa Diab, who is a mental health professional who does similar mental health advocacy like myself from the States. Alhamdulillah wa shukr. This type of awareness, now we can say that people take it a little bit more seriously, to the point where we see from the work that I've been pushing on my own through the Muslim Counselor medium as well as through the Serenity Group, you see now, do you not see some of the English speaking scholars on the Mumbar talking about mental health? That push, that psychoeducation, addressing these issues. Resources, sometimes we don't know where to go. Inshallah, by the end of this presentation, you'll have a handful. Cultural sensitivity, meaning when we go see a therapist who doesn't have a similar background as us, do we feel that we're going to understand, they're going to understand? Sometimes no. What was interesting in the research that I did in my graduate studies is that is an issue. People will not go and get therapy because that's not a Muslim person with the Muslim knowledge. How are they going to treat me? Sometimes I have clients come to me and say, I prefer to talk to somebody of a cultural background or Muslim background because I don't have to explain to them why I have to be home at 4:30 when it's dark outside, but it's still 4:30. Because my dad said I have to be home when it's dark. You don't have to explain these nuances. I hear this from clients. On the flip side, I can tell you, having studied and worked in the field and worked with other people of different cultural backgrounds, is that we get the training for it. I hear parents, أنا ما راح أودي طفلي يروح للدكتور راح يخربوه على الدين. They're going to push him away from religion if I take them to a non-Muslim professional. Not necessarily. It's about the right fit. It's about connecting with the right professional. Sometimes personality as well. But we are culturally trained, even more so now than we were before. People have an understanding. By the way, I see a therapist. What's the expression in Arabic that we have? Maril, what does it go again? Huwa alil. Help me out. Do you know which one I'm talking about? No, it's it just slipped my mind. We'll come back to it. Say it again? Yudawi nas wa huwa ali, right? He helps and treats people, but they're sick. But that's not the idea here. That's not why I see a therapist, and we'll get into that in a second. It's because I need that space to talk to somebody who can reflect back to me what's going on personally. Because when you're stuck in a situation, can you see the things around you? It's not objective. Your subjectivity comes into play. When you talk to family or friends who are close to you with the problem, absolutely they can provide support and guidance. But are they going to be objective? So that's why you need that third party. Finally, shame. This is a big one, I would say, when it comes to our communities. The idea of shame. People don't go and get support because Allah subhanahu wa ta'ala is the ultimate of helpers and supporters. Absolutely. But when you just stick to that, think about that. God has given you the resources, right? Through the professionals around you, through the treatment, through the medication, through the therapy. That in itself is a blessing from God. There is no illness that God has not provided a treatment for. So we need to shift that mentality. Shame, aib. It takes incredible courage for somebody to go and ask for support and get the help that they need. Would we say it's ayib on the person who needs to go get insulin for them to go get insulin? Is it ayib if they go get insulin? No, they need it. They need it to survive. Wouldn't you say? Perhaps during this time frame, the person who is dealing with depression needs that medication, needs that support to get through this time frame. There is no shame in that. There is no ayib in that. Right? Yes? Sorry, ما سمعتش. إن إيش يسوون؟ Okay. They give their opinions يعني? I'm not saying there isn't. Absolutely. الأخت قاعد تقول إن مو كل الدكاترة ما راح يأثرون. But then I'm going to say the same thing. إذا ترحين الطبيب not psychologist, محامي, anybody who has a service to offer, if they're not following their professional guidelines and regulations, they're going to have a bias. They're going to throw in their bias. You know, I get that a lot in my work too, some people. Oh, she's Muslim, she's fundamentalist, she's going to influence people to become Muslim. Really? I've heard this stuff. I'm a professional in my field. I'm here to treat and help. Whatever I believe is aside. I get clients of homosexual backgrounds. Am I there to judge? That's haram what you're doing? Is that my role? I've asked about this. I've discussed this with scholars. What's my role here? Because this becomes a conflict. But it's a personal conflict of interest which you need to deal with, put aside, and focus on what it is that you need to do with the client in front of you. This is training that we get in all of professions. And I know teachers have been struggling with this. When you do adhere to a faith that goes against what is happening, it's sensitive, it's delicate. Now it's become a human rights issue. So we have to be very careful when our own personal religious beliefs are in conflict with our professional work, right? So we have to be careful how to manage that. This is one tiny example. What I'm saying here is you will have people who will do that. Are they truly professional in their field? Do you want to be getting treatment from them if they're going to have a bias? Probably not. So that's why when you go see a therapist, you just don't go to one. When I refer students on to specialists, I give them a list of people that I know personally, that I have worked with. And if it's somebody I don't know, I tell them, this is the clinic, I don't know who you're going to get. This is the person with their private practice, I know who they are. I've worked with them before. They're retired counselors from our university, they have their own private practice, for example. So when I send them to them, I tell them, call and connect with a few. Don't just go to one. See who you connect with the best. I have students who come see me, perhaps, but they don't like the sessions with me, they go to somebody else. Vice versa. They go see one of my colleagues, they don't connect with them. They come and see me instead. So, yes, it happens, but you pick and choose who you can go see. There are, mashallah, so many. So many. All right, let's speed up a bit. So we talked about that. When we take a look at why should we access these resources, and this was mentioned earlier, so that to help with the processing of challenges that you get in your life, right? We have, time out for a second? Time out? Time out. Sorry? 12:45. Oh, I thought it was 1 o'clock.
No, it's 12:45. 1 o'clock is correct.
Okay, can I just finish up, this is the first part? Yeah, I want to finish up part 1 so that we start fresh for part 2 after. Are we okay with that? Because I don't want to, you're okay, Hajji? Okay. All right, so I'll just speed it up a little bit because I really wanted to get into the detailed aspect because part 2 builds on this information. So why do we go see a therapist? To help process the challenges that we experience in our lives, right? We have changes. Sometimes we have deaths. Sometimes there are divorces. Sometimes people move. These are big things that happen in our lives. We don't just move along with them and just, that's it. We need a safe space to deal with it. So we can get back to our baseline functioning when we're out of our usual function. To work through these different traumas, crisis, and life struggles, right? For self-growth, Sometimes I have people come to me and say, you know, I need to talk to somebody because I don't talk to my family or my friends, or I don't have anybody to talk to. I want to talk to somebody who's objective, that has these things to help me work on something personal that I want to develop. Support, right? Let's say you are going through a divorce. There are children of these families that need the support to be able to not be put in the middle, right? And be neutral, etc., etc. Loneliness, especially working with international students that come from abroad. I recall this one student that stood out in my mind, bless him, an Iraqi student. I was so excited. This is one of the first students, right? Group of students that came from Iraq to study in Canada through the embassy program. I was so excited. I kind of felt he was obviously Arab, but I didn't know where he was from when he first came in. And then so part of my questions would be, you know, where are you originally from? So I have a better understanding how to support them. He said, Iraq. La wallah, ti Iraqiyya. Haram, khatiyya. Farah. He became so happy to hear his mother tongue. Unfortunately, he didn't stay in Canada. He went back home and studied at in Turkey because he couldn't adjust. It was too hard from him. Hanoun al-watan, and his family and his kids. He couldn't stay away. Even though he had people, he still felt lonely here. I still keep in touch once in a while through social media how he's doing. Alhamdulillah, glad to see that he's doing well. But a lot of people use that counseling because they feel lonely. They feel they cannot connect with other people. So most common illnesses, let's go through this quickly and I need your help. Anxiety, right? What else? Shout it out. Depression, suicide, addictions. Like we said, it can encompass a variety of things, not just drugs and alcohol, but gambling and pornography. Interestingly enough, they're called the Muslim Youth Helpline in the UK. This is a telephone support line for young people and adults as well. The research that they did showed that more women were accessing pornography and using that, and there are problems with that, than males. Why do you suppose that is? It's because of the lack of proper sexual education in our communities. This is something we need to address and talk about, especially our communities. Aib, haram, mayjuz, maislayat, right? But these are important things that if we don't teach our children these things, they have access on the internet. They have access through their peers, their phones. It's accessible everywhere. If we don't teach them with haya and modesty, the appropriate etiquettes and knowledge around sexual education, they're going to get it elsewhere. They can potentially be addicted in an unhealthy way. Mood disorders. This is very interesting when it comes to borderline personality disorder and narcissism and narjisiyya, which comes out in the form of abuse. A lot of abusive relationships is based on these types of personality disorders. Cross-generational issues, which I think a lot of our young children experience with the parents, right? They grew up here. They have different values and morals around them from the students and the influences than what the traditions that we have. And so, boom, you've got that clash with the two generations. These are common issues I see. Identity issues, especially as Muslims living in the West. The confusion, who are we? What am I? I think we've all had to learn how to adjust to that and understand and label what our identity is all about. I've comfortably come to the idea of me being an American-born. I was one of those, part of the dysphoria where my dad came to study abroad. So American-born, Iraqi, Karbala'iya, Canadian. That's how I kind of identify. I grew up kind of trying to figure that out. And our kids are going through that. So we have to be able to give them that knowledge and support and exploration to be proud also of figuring out what their identity is in a healthy way, right? Not by force. Then we take a look at PTSD. This is pretty common in the last few years as well, right? Post-traumatic stress disorder. You have issues related to domestic violence, like we mentioned, abuse, sexual abuse, child abuse. We know in our communities that spanking or hitting is considered cultural discipline. Here it's against the law. And we know we have these issues and fears in our community with the Children's Aid Society taking kids away from our families. These are common when it comes to tarbiyat al-atfal bil-darab. It's also, by the way, if we look down in our religious values, it's forbidden. It's cultural. It is not religious. Islamophobia, right? Especially here in Quebec. Absolutely. and we have obsessive compulsive disorder, eating disorders, right? Body image issues. These are pretty common as well. So counseling, what is that? We have this big definition here, okay, of what counseling is all about. Testing aptitudes and techniques, etc., etc. I prefer this definition, where I call it the BH, Barak Hussein definition of counseling. It's a softer version, I would say, and it's what I've accumulated over the years. Confidential, safe space for people to talk about whatever it is that they bring here, right? And depending on what it is, then we can set up goals to helping people reach them. No judgment. This is important when it comes to counseling. We accept what you bring in so we can help you, even if we disagree and don't like it, right? Could be short-term, long-term, could be about all of these issues we've discussed. So why do people avoid counseling then? It seems like a safe definition. It seems pretty understanding. Perhaps people do that based on shame, fear, taboos, all the things that we discussed. Would you say that's a fair assessment? Yeah? Even people who are struggling, they won't go get help. Again, they're worried about what people are going to say about them, right? And last question here, is counseling only for people who are affected with mental health illnesses? I see a counselor. I don't consider myself having mental health illnesses. Struggles, عادي طبيعي. كلنا عندنا هالمشاكل الصعوبات بالحياة، صح? So talking to a therapist is not necessarily because you're dealing with an illness. It could be for other reasons. Quickly with gender, this was mentioned earlier. So Muslim men usually deny or have more negative views towards seeking help. We mentioned emotion earlier. Men don't cry. Big boys don't cry. دائما احنا نربي اولادنا بهالطريقة هاي. انت رجال ما يصير تبكي, right? So the idea here is interesting because if we look from a faith perspective, not culture, doesn't our religion encourage the show of emotion? Again, look at the last 2 months. Look at Muharram, Ashura, the culture where it is encouraged to show emotion and tears for the tragedies that took place, right? Men are encouraged to cry during these majalis, right? Why can't we apply that in all areas of life to show? Because showing emotion takes courage and strength. It is not a sign of weakness. As parents, we are responsible to train that idea into our young children, right? This gender variance is very important. So why is it then, is it true that mental health illnesses affect more women than men, even in our community? What did we mention earlier when it came to suicide? It's more, we said that men would probably, that the statistics show themselves as higher because of more violent deaths. But then here the statistics show in the general population, including in ours, that more women tend to have illnesses. Is that true? It's not because they have more illnesses. It's because women will tend to get more help. They will reach out for support, so the statistics are skewed that way. Does that make sense? So we need to create that culture of acceptance and support and understanding. It's okay to ask for help. We need to support, because then we're going to be stuck with those ideas that are not helpful. I'm going to get into more details with this in part 2. Just quickly, how do we help other people? It's by listening, and we'll look at the LG model later. Acceptance, meaning no judgment. When somebody comes to you and says, I've had thoughts of killing myself. Haram, راح تروح بجهنم. ما يصير تقتل نفسك. Haram, ما يجوز. Can't be playing the haram police here. Not at all, because you're going to push this person away. You want to bring them in. Listen, accept, encourage, support, and counseling. I'll come with you. Let's go book an appointment together. Let's call this helpline. And let's take, so I have this article here which you have access. You can take a look at that. These are some of my favorite books that I actually use in my own practice. And I actually did a review on this last book called All the Perfumes of Arabia by Bilal Muhammad, who is a young man in our communities. He wrote this book describing the different perfumes and how they impact history. And there's one specifically on mental illnesses, depression and anxiety, where he discussed lavender. Beautiful chapter. So I highly recommend, if you want to have these books in your school, they're really great to adhere to. The brothers from our community, Shia, these two are not, but I looked at them and there's some good information in there as well. We'll get into more detail on self-care, but it's really important that although we can be providers and helpers and supporters, we have to take care of ourselves and take care of our mental health and our overall well-being. I'll get into this detail a little bit later, but it's the things we've already mentioned: eating well, sleeping well, exercise, spirituality, that inner peace, taking medication if we need to, having good relations and connections around us. I know it's hard, let's say if you're living with somebody or dealing with a family that is toxic, and we say we have to respect our elders and our family. There are guidelines also how to still keep Sulat al-Rahim but not engage with the toxicity, okay? Counseling, and go talk to a counselor, and there's so many lectures online. If you go to my actual YouTube page, The Muslim Counselor, lots and lots of recorded programs and events, different topics, but also other than mine, there's lots of others out there as well that I highly encourage. Finally, I always like to end off this part with this beautiful quote that is attributed to Imam Ali alayhi salam, where it says, "Your remedy is within you, but you do not sense it. Your sickness is from you, but you do not perceive it. You presume you are a small entity, but within you is enfolded the entire universe. You are indeed the evident book by whose alphabet the hidden becomes manifest. Therefore, you have no need to look beyond yourself. What you seek is within you, if only you reflect." And this reflection, inshaAllah, is from the knowledge that we have looked at today, that you have put into your toolbox as teachers, as parents, as important members of our community, to reflect more on how you can put all this together to be wonderful ambassadors for mental health in our community. Forgive me, I went a little bit over the time. I was under the impression it's 1 o'clock, not 1:45. So we're not going to do this meditation now, of course. I think the best of meditation, of course, is our salah that we're going to have, inshallah. Sallu ala Muhammad wa ali Muhammad.